Alright, so I just squeezed every little bit out of the bag. Now I'm going to disconnect it. Flush it with the saline. Here we go. Shut that so it doesn't get messy. Now, taking this stuff off is kind of tricky. We don't want to pull the IV out yet. So we'll get rid of that. That little piece of tape I have on here. I'm going to tell you a trick. I have to do this every week, and I only have so many veins. I'm 55 years old, and I'll do this for the rest of my life, which may be 10, 15 years at this point, because alpha-1 antitrypsin disease is causes emphysema in the lungs, and in some cases liver disease, and sometimes both. But in me, I have emphysema, and I have just a little over 40% of lung function, and so sooner or later I'll get a lung transplant. But I want to preserve my veins as best I can and avoid as much scarring as possible. So the trick I learned, in most hospitals, they pulled that thing out of there real quick, but what happens is there's this little plastic piece in the vein, and the blood and vein kind of adhere to it. So when you pull it out, you rip the skin and part of the vein a little bit, and so you get a scar there and damaged tissue. So what I've learned is I put my gauze on there and pull it out slowly as not to tear it, and then hold that on there for a second. And I got my tape prepped over here ready to go. Push that on there good, and bam, that's my weekly infusion, and I will continue to make these as long as people are watching them. Alright, so thanks for looking at my TikTok, and I'll see you next week.